Yeah, and welcome everybody who's watching today. We're talking about anxiety and how it relates to your gut health. And we've got one of my really good friends and colleagues, Dr. Seth Gerlach. He's an expert in anxiety. And like I was saying earlier, he is with drsethgerlach.com, and he specializes in women, helping them reclaim their brain, gut, and energy. Super glad to have you on, Doc. How you doing today?
Thanks, Dr. Anise. It's awesome to be here. I'm doing really well. It's really nice here. It's really hot, actually, but it's a super nice day.
That's great. That's great. Hopefully you're enjoying the warmth. So let's dive right in. All month on our page, we've been talking about anxiety over here at Acupuncture Fit. And hey, if you're watching, I just want to encourage you to, if you have any questions, comment in the comment box, and Dr. Seth or I will get right back with you. If you could just share this post, if you like what you're hearing, share this live, heart it, and spread the news about what we're talking about here. So yeah, Dr. Seth, maybe you could tell us a little bit about your background and what you do more specifically than my introduction here.
Sure. And so everyone else knows, I met Dr. Anise last year in Park City at an awesome conference, and we just hit it off right away, and just been in touch ever since, help each other out and talking about helping people. And that's what I love about you, brother. So yeah, a little bit about me. I was really sick as a kid, and by the time I was 18, I was on 5 medications for anxiety, depression, migraines, vertigo, wild joint and muscle pain over my body, GI symptoms, brain fog. So I had a lot going on in a short period of time, and that's what pushed me into functional medicine and natural healthcare, because every doctor I went to said, oh, it's all in your head. There's nothing wrong with you. Just keep taking these medications. And eventually I got tired of hearing that. So I'm like, I'm going to do something a little bit different here. So ended up going to chiropractic school, and then did postdoctorate work in functional medicine. And that's kind of where I ended up. Now I love helping people kind of reclaim their health. I love looking at the gut. I love anything brain related. I love anything immune related. So those are the people I work with now, and I really enjoy doing that. So we utilize functional medicine, which is it's a new kind of healthcare, but it's taking the country by storm, because it focuses on why people are sick in the first place instead of just covering something up with symptoms. I know you do the same thing, Doc. And we're looking at the entire body and seeing, okay, how's the digestive system and the nervous system and the endocrine system, and how do these all relate together, and how can we get people back on track naturally? Which is really what it's all about, because people come to me, I'm sure they come to you too, and they're like, Doc, I am so sick of taking medication. I'm sick of people not listening to me, and I'm just ready for a change. Do you hear that too?
Doc, I hear that all the time, and you're absolutely right. There's an explosion right now in functional medicine and bringing our bodies back into function, into optimal health, right? And figuring that out. So that's a huge part of why we're doing this live today, because there is, and according to Harvard Health, there is a gut-brain relationship, right? Have you ever heard of the term gut wrenching, or a situation that you're in that causes, nausea? I mean, even when you start to smell food or think of eating, our stomachs start to naturally produce gastric juices. Our brain sends signals to our stomach to start contracting. So as a matter of fact, there is a gut-brain relationship. Now, the relationship necessarily doesn't have to be gut to brain or brain to gut. It can be vice versa. And there's studies out there showing that this, in fact, is very true, and it can affect our anxiety.
So true. I love the gut-brain connection, because there's so many new studies coming out of this now. And just with the gut in general, I think we know, just so little about it, which is crazy because it's so powerful that we know of. So we're all figuring out these new bacteria and these neuronal connections and all that. But you're exactly right. When we're formed in the womb, our brain and our gut are connected via nerves, and we're still connected via something called the vagus nerve, among other things also. So the gut and the brain communicate. And so we used to think, oh, wow, the brain always tells the body what to do. So the brain's always telling the gut what to do. And that is true, like you said. Like, if you smell food, you're going to start secreting enzymes so you can eat that food. Butterflies in our stomach, that's the brain going down, same kind of thing. Excuse me, the new cool research coming out shows that up to 90% of those neuronal signals go from the gut up to the brain. So I tell people, you know how you have butterflies in your stomach if you get nervous or something like that. What if you have butterflies in your head from your gut? That's something crazy to think about, but we don't know. We don't put two and two together. Like, oh, like I've got brain fog today, or what was that thing I couldn't remember it, or man, I'm anxious. Well, all that could be coming from your gut, and you don't even know it. So that's something people really need to take into consideration. Start thinking about this. Is wow, how does my gut affect the rest of my body?
So I take it if there's symptoms that are occurring in our gut, in our GI tract, and then we also have symptoms, relating to our head, such as brain fog and lack of clarity, it could either be one or the other. And research is showing it's not just the brain that's causing this, right? It could be our gut that's causing this. Man, that is so powerful. I know there's been 13 major studies done showing that people who work on their gut can help improve their anxiety. Isn't that right?
I see it all the time. So this was me, myself too. Just, personal story. Again, I struggled with anxiety, depression. I went through all these things. And part of my healing step was cleaning out my gut. It sounds easier than it is sometimes, but there's a really delicate balance of bacteria in our gut. Our gut is where we digest and absorb our food. It's where most of our immune system is. So this is a very important part of our body. So I see it all the time where people come in with XYZ symptoms. Doesn't have to be brain related at all. It could be something else different, autoimmune disease, an inflammatory disease, whatever it may be, and we clean up the gut, and their symptoms miraculously go away. It's just kind of crazy. But so when we talk about like how does cleaning up your gut like make your brain better? So if we come back to it, like I said, you digest your food, and that's how you make energy. That's how you use things in your body. Well, you make things like serotonin and dopamine in your gut. 90% of your serotonin, 50% or more dopamine comes from your gut. So it's really kind of crazy. And we make these things from amino acids. Amino acids come from protein, protein in food. So if you're not properly breaking down your food, which I see all the time today, you're not going to be able to have that raw material to make your happy, feel good chemicals. Serotonin, dopamine keep us healthy and happy and stable. So that's kind of step one in, hey, how does our gut relate to that? Another step really is how the gut communicates with the body. So 80% of your immune system's in your gut. That's really kind of wild to think about. So when we think any type of autoimmune disease, any kind of inflammatory disease, we start in the gut because that's where the immune system is. The immune system communicates by these things called cytokines. It's a big word. All that really means is these guys are the connectors of the body. They help communicate and talk to one another. And so when we eat certain foods that create inflammation in our gut, they create these cytokines, and those cytokines can go up all the way to the brain. And that's where we can get those symptoms of anxiety, depression, brain fog, memory loss, whatever it may be. So those are simple things we look at, how the gut really affects the brain.
That's brilliant. Thank you so much for sharing that, Doc. So we figure out how this relationship is happening and cytokines and how our gut is communicating with our brain. It's almost like I want to call the gut the second brain of our body, right? Because it has that much effect on all of these aspects of our body. It's very, very powerful to look at both of the relationships. So we figure out what's going on in the gut, right? Whether a patient's suffering from constipation, diarrhea, or maybe even some more severe symptoms such as IBS, ulcerative colitis, you name it. And hey, just another quick note, if you're watching this right now and you know somebody that's suffering from these symptoms, please share this live with them. Comment, shoot us a message privately if you don't want it publicly on Facebook, like it, heart it, and share this. So back to these severe symptoms, if someone is suffering from this, step one is to figure out, what is going on. Then step two, what are your suggestions, or what are some of your biggest tips to help relieve some of these symptoms, alleviate them, or even possibly get rid of them?
Yeah, a couple points there. You brought up a lot of good points, and you said IBS too. So actually, some new studies show, 70 to 90% of those with IBS, 70 to 90% of those also have, they call it a psychiatric comorbidity. That's big words for saying you got something wrong with your brain too, like anxiety, depression, schizophrenia, whatever it may be. So you start putting together these links like, wow, that's a lot of people that have gut problems that also have brain problems. Like, that may be connected a little bit. But if we're going to do this, what I see a lot is, you can have a gut problem, but not have a gut symptom like constipation, diarrhea, gas, bloating, pain. That makes it a little more difficult because people are like, well, I don't have anything wrong with my gut. Like, it feels fine. It's not bloated, or I don't have pain. So there's nothing wrong with it. But like, I see that probably over 50% of the people that have no GI symptoms, I test them and we find either a parasite, candida, bacterial overgrowth, H. pylori, SIBO, one of those that's causing havoc, and the symptoms are just showing up somewhere else, But back to your question on how do we kind of get ahead of this, I think a lot of things start with food. And so it's a little harder today. Our food's been adulterated a lot, and our food supply has changed more in the past 40 years than it has in the previous 4,000, just with things like genetic modification, hybridization, pesticides, herbicides. All these things are changing how food interacts with our body. So, and that's going to affect our gut, because our gut's kind of our first line of defense. It kind of takes the beating. So we have to look at whole unprocessed foods, organic foods when possible, grass-fed, pasture-raised if we're doing meats. We want to avoid sugars, because sugars really can wreak havoc on a gut. And a lot of times, there's certain foods that people react to, and it's a food sensitivity, not necessarily an allergy. Like, hey, I eat a peanut, my head like explodes, or shellfish and my throat closes. But it could be a sensitivity where you don't experience those symptoms for days. And some of those foods can be things like gluten or dairy or eggs or soy or peanuts. So I would really start, what I like having people do is start keeping track of the things you eat every day and write them down. I don't know if you have people do this too, but it's really kind of eye-opening for the people themselves. Like, wow, I can't believe I ate all that yesterday, But you can start correlating symptoms and say, wow, I was really anxious the past couple of days. Let me look back at my journal and see what I ate, how much I slept, did I exercise, what was my stress level? And you can start connecting dots there and say, wow, I ate pizza 3 times in a row, and then I was really anxious. So food is a great place to start for people. Looking at your digestion, making sure you're passing at least 12 inches of stool a day is very important. Making sure your stool is brown and formed. These are all normal things. People don't like to talk about poop, but I will talk about poop all day. So maybe a digestive enzyme or something like that can help you break down and digest and absorb your food. Other things like stress and medications can break down the gut lining and make all this worse too. And I tell people, try all these things first. If you're still having troubles, maybe seek out a doc that can help walk you through this, or a holistic health coach, a naturopath, whatever it may be, to look inside your gut and see if there is something going on there.
Doc, you said so much I'm going to come back at you with. This is great. So you mentioned that anxiety can surface and a patient might not even have a problem with their gut, right? Our bodies, and I stress this to patients a lot, are built for comfort, right? That's how we're built. And a lot of times when these symptoms are surfacing, it's really the pathogen or the disease or whatever is going on in the gut is really getting to us, because our body's sending signals of these symptoms saying, no, really, help me. And, it's all about prevention, right? So if we can figure out beforehand, like you were saying, what is going on in the gut, is it inflammation, and we don't even know it, that's really key to helping lower and reduce and preventing even from anxiety going, out of control. Secondly, you made a really good point that where our bodies aren't used to getting food from a window or eating out of a bright, colorful box with processed food and or sugar. It's funny, there was an experiment done where I think they put a certain amount of sugar in a rocket ship and they heated the sugar up, and the rocket ship went up 1,000 feet, right? So sugar is combustible. I mean, when it gets heated up, it causes what? Inflammation. And our bodies are warm. So when you get this processed white sugar into our bodies and it gets heated up, our body, as a defense mechanism, can get inflamed. And where does that sugar go? Right through our gut, stopping all of these different chemicals that communicate with our brain, causing all kinds of symptoms to go haywire. So we really want to look to help reducing inflammation with a lot of the wonderful products, such as, probiotics that you were talking about, and eating the right foods, unprocessed, organic, non-genetically modified foods is so key in this relationship, as we were talking about earlier with what they said at Harvard. Now, in traditional Chinese medicine, we believe that every body can be categorized actually in 5 different body types, and we can figure out what body type a patient is, and then we can prescribe a food therapy regimen to them, which is really neat. So if you go over to our Facebook page over at Acupuncture Fit, I've got a link to an e-guide that I wrote with Dr. Tuhill regarding how you can figure out what foods are right for your body type, and we kind of break that down for you. So go over and check that out. And again, if you like what you're hearing, or if you know somebody that's suffering from this, please share this with them. Like this post, heart this post, and we can spread the word that people do have options, to help their extreme anxiety. So Doc, I mean, I'm just blown away with your knowledge and everything that you're sharing with us today. In closing, is there anything that you want to tell everybody to, see if we can bring or shed some more light into this relationship of our gut and our mind?
I think we touched on a lot of good points already, but what you kind of just said there are other things out there. There's hope. So like I did, I went to the doctor. They said, this is your only option. You have to take medication for the rest of your life. But today there's so many great alternative. I hate saying alternative because it's not, it's what people
Options.
should go through first. Yeah. There's
Right.
other options that can help you learn about your body and help you regain your health, so you're not reliant on medications or any other things for that matter. And you can actually learn the foods that are right for you and what kind of stress you can handle, what kind of exercise you can do. The gut is so powerful, and I just because it's my personal story and it's so close to me. That's why I love talking about it and love sharing it, and because I see it every day. But learn to notice these small things that you do every day. Start taking and keeping track of that, and see how your gut relates to your health in general, and your brain, your anxiety, things like this. So that's what I leave people with: is really just open your mind to the possibilities. And yeah.
Doc, you have such a good heart, and I can tell your passion, about this for sure. So, again, I want to really thank you for being on here. And if you could tell our listeners maybe how to reach out to you if they have questions, maybe even set up a virtual consultation or get more information from you, what's the best way for them to reach out to you?
Sure. And I really appreciate you having me on, Dr. Anise, and we need to meet up again for sure. Um, so my website is drsethgerlach.com, and I do free 15-minute discovery calls for people that are like, hey, I don't know, is this right for me? Is this something that functional medicine can help with? I love jumping on and talking with people and saying, yeah, that's something we could do, or hey, I don't know if that's the right fit exactly. And I'm on Facebook, Dr. Seth Gerlach, and Instagram, Dr. Seth Gerlach there. So follow me on there, and love to be in touch.
Awesome, Doc. Well, thank you so much. I hope you have a blessed, wonderful rest of your day. Really appreciate you being on here today. My name is Dr. Anise Khalaf with Acupuncture Fit, so stay tuned. We're going to be bringing a lot more content and wonderful education regarding the fact that you have options for your health. Thank you so much, Doc.
Take care.
Take care.